Good morning, everyone. Thank you so much for joining us today. My name is Andy Bernstein, and for those of you who are not familiar with us, we are Accessible Pharmacy Services. I'm joined on the call by some of my colleagues. Three of us will be speaking today. Myself, one of my business partners and co-founder, and also our Chief Medical Officer, Dr. Jason Barrett. Also speaking today is Lynn Heitz, who's our Director of Business Development. There are two other people from our company who are listening in today and on mute. Dr. Alex Cohen, who's also one of our co-founders. He's also our Chief Marketing and Accessibility Officer. And Alexandra Luzier, who is our our Vice President of Business Development and Communications. So before we get started, I want to thank Jamie Pressman in particular for facilitating this today and inviting us today and helping guide us through, really trying to put together a good program today so that everyone can learn and take some of that knowledge, into the homes.
It's just,
Help the people who we're helping.
and they would be in a box still, right?
I will ask everyone to mute themselves if possible. At the end, we will have time for some questions. We will be sharing a PowerPoint today. We're going to be speaking loosely about a few topics. Basically, there's going to be today's presentation is going to be broken into 4 different sections. I'm going to give a very high level overview for about 5 minutes about what accessible pharmacy services, what we do, and what makes us unique, and how we support patients. We're going to be speaking about Be My Eyes, introducing everyone to Be My Eyes, explaining how Be My Eyes works. There's a lot of functionality to Be My Eyes that a lot of people are not aware of. And in particular, how we can support the people who you're touching in the homes, in their homes, about how to help them manage their medication and manage their diabetes by using a tool like Be My Eyes. Jason's going to be speaking about glucose monitoring, and in particular, continuous glucose monitoring systems. What a game changer they are for the blind and low vision community when it comes to diabetes management. And Lynn Heitz is going to be speaking about the Center for Disease Control's Diabetes Prevention Program. Lynn is a certified diabetes lifestyle coach. And I'll explain about how that all came about. And Lynn's going to speak loosely about the program and how we support patients in Pennsylvania who are pre-diabetic and who have diabetes, and how we're able to help them live healthier lives. So I will get started. As I mentioned, we're going to be speaking for about 45 minutes to an hour, and then we'll have time for questions. And obviously, if if people have questions afterwards, or there's things that you're not comfortable sharing in a group session, or you feel it needs more time than on this conversation, you can email us at info at accessiblepharmacy.com. Our phone number is on our website. Jamie has all of our information as well, so please feel free to reach out to us afterwards. So I'll get started with a background about accessible pharmacy. Before I really dig into accessible pharmacy, BBVS and the OVR in particular plays a role in accessible pharmacy. Accessible pharmacy wouldn't exist if it weren't for the OVR BBVS. The reason for that is Alex, who is here today but not going to be speaking today. As I mentioned, he's one of my business partners who co-founded this company. Alex is blind, and in his 20s, the BBVS, the OVR office in Philadelphia, in particular, was responsible for a collection of there were 4 different individuals. Help Alex learn how to use his cane, help Alex learn how to manage his household and live independently in his home. Taught him some of the assistive technologies and how to use a computer, and most importantly, help Alex apply for his master's program and his doctoral program and get funding and scholarship for his doctoral program. Alex has a PhD from Drexel, and all of his academic research and his doctoral dissertation is really focused on, creating an equitable and accessible marketplace. And his doctoral dissertation was loosely, focused on researching the consumer experience for blind consumers. A great deal of our business model is based on his academic research. So tie that all back around. If it weren't for the OVR, Alex wouldn't have been able to achieve his doctoral program and help create our business. So we're very loosely grateful for the OVR and its role in helping us build accessible pharmacy. For those of you who are not familiar with accessible pharmacy, We are a home delivery pharmacy service. We specialize in patients who are blind and have low vision. We're the only provider of its kind in the world. We're the largest blind-owned healthcare company in America. And everything that we do is about merging healthcare and accessibility, and really empowering the patients who we work with to manage their healthcare, to manage their diabetes, to manage their medication, more independently, with less stress, and to have healthier lives. We operate in 29 states throughout the country, as well as DC and Puerto Rico. We employ individuals with disabilities. About 25% of our staff are blind themselves. And we also play a role in supporting groups like the BBVS, the OVR, and when you're in the home with an individual, working together as a team. We're going to discuss today some of the solutions and some of the ways that we do that. But working with a provider like the people on the call here, like how do we work together to empower that individual? How to empower that customer, client, or patient, whatever everyone calls that individual, collectively to get them to a better space. Diabetes nationally, but in particular in the state of Pennsylvania, is an epidemic. It's incredibly challenging. The numbers are off the charts. 53% of the people who we work with, our patients, have diabetes, and it's the leading cause of blindness in America. And managing diabetes is incredibly challenging for everyone. When you add vision loss into that, it becomes significantly more challenging and complicated. And so we've developed some best practices ourselves by working with these individuals, by working with the OVR, healthcare providers, with hospital systems, with different technology companies and solutions. And there's some hope. And so we're pretty excited to share some of this information with you today. A quick background about what we do as Accessible Pharmacy. We are a home delivery pharmacy service. So anything that an individual can get at a traditional pharmacy, whether it's prescription medication, over-the-counter medication, vitamins and supplements, a full range of diabetes supplies ranging from glucometers, syringes, continuous glucose monitoring systems, medication, insulin. We also provide small accessible medical devices and train people on how to use those devices. We provide guide dog and pet medication. But what makes us unique is how we wrap accessibility around each of these things. The things that we do that make us accessible, no charge for them. We get reimbursed by insurance companies. In some cases, we also get some funding from the Department of Aging, the Department of Health, the Center for Disease Control. So for an individual to work with us, there's no additional financial burden for them to work with us. We wrap accessibility around all of these things that we deliver. And it's unique. It's one-on-one. We're agnostic towards solutions. It's all about what collection of packaging and labeling and education and support and delivery works best for that individual. So we have a full collection of accessible packaging. Like we have pre-sorted disposable pill organizers. So rather than someone getting their meds in bottles and organizing themselves, they simply they get delivered to their homes every month automatically, pre-sorted. And we can sort prescription meds, over-the-counter meds, vitamins and supplements. We have individual daily packets, we have the same machine that Amazon has for PillPack, which is essentially a 2-inch by 2-inch plastic baggie that comes pre-sorted with meds. We have standard size bottles. We have easy open bottles for someone that may have Parkinson's or arthritis. When it comes to labeling, we can add different levels of labeling to all of these packaging. So we have traditional text labels, and we can do the traditional text labels in 200 different languages. We have grade 1 and contracted braille labels. We have large font labels with different color contrast backgrounds for people who would benefit from that. We have a collection of talking labels. We have ones that we're developing ourselves, actually, with the Helen Keller National Center, specifically designed for the deafblind community. We embrace all the existing talking labels that are in the marketplace, like the WayTag labels from Way Around, or the Script Talk labels from Envision America. For those of you who aren't familiar with talking labels, I'll do a really quick demonstration of one. And we can add these labels to any of the packaging and train an individual to use them, either by downloading a free app or sending a free device. So for those of you who aren't familiar with talking labels, here's an example of one.
Patient name, Jane Washington. Medication, furosemide 40 milligrams. Instructions, take 1 tablet be mouth once daily. Quantity, 60. Bill date, February.
All right, you get the gist of it. We can do that in multiple languages as well. So once again, these are all different things, all one-on-one. It's personalized medication. It's figuring out what collection of packaging and labeling and delivery works best for that individual. That being said, there's another layer here. I'll use it as a segue to the next thing we're going to be speaking about, which is, how do we engage in these conversations with these patients? More often than not, the conversation starts with a telephone call where we have a conversation with the individual. We discuss packaging, we discuss labeling. We speak to them about what kind of challenges they have with their medication, what's working for them, what's not working for them. We then will reach out to the insurance company to confirm eligibility. We will reach out to the prescribers to get feedback from them. Our pharmacists and our healthcare team will review all the medication just to make sure that there are no unintended side effects because of the combination of these things. And in about 24 hours, we call the patient back. And if they want to move forward, we start. And the next time they're due for their medication, it just shows up on the front door. So that conversation, more often than not, happens on the telephone. However, it can also happen other ways. One of the ways I'm going to start speaking about now is through Be My Eyes. So for those of you who are not familiar with Be My Eyes, we are the healthcare partner for Be My Eyes. A lot of people, let me take a step back. What is Be My Eyes? Be My Eyes actually has 4 different levels that we use Be My Eyes for. Be My Eyes is a free app that can be downloaded onto a smartphone of an individual. The app was created by a blind man in Denmark, and it essentially functions almost like as a FaceTime on an iPhone, or I forget what the corresponding name is on an Android, but it works both on an iPhone and an Android, and it's a one-way FaceTime, and it connects 2 groups. It connects a blind or low vision user with a party that is sighted. So on the simplest level, there's a volunteer network. It's an international volunteer network. In the United States, there are 500,000 blind users currently using the app. And there are 4 million volunteers. So a blind user, when they're ever in a situation where they would benefit from connecting to, they would benefit having someone from sight supporting them, they simply open the app, connect to a volunteer, and engage in a conversation with that volunteer about whatever's in front of the individual who is blind. I'll give you an example of my own before I give you some case studies here. I'm also a volunteer. I've had 1 call, and it was about a year and a half ago. And the reason why I've only had 1 call is the second a user initiates trying to connect with a volunteer, it tries to connect with one of those 4 million people, okay? If you don't pick up in a thousandth of a second, it automatically routes to the next person. So I've had 1 call. The woman at a vending machine, a food vending machine. She was blind, and she wanted to get pretzels. So she held her phone up to the vending machine. She explained to me she wanted pretzels. She held her phone up to the vending machine. We were able to identify the pretzels. I helped her enter the digits into the keypad, slide her dollar bill into the thing, and get her pretzels. And it was awesome. That's a very simple level about how Be My Eyes works. Other ways that Be My Eyes works. Now, for those of you who are not able to see this, I'll explain what's on the screen. These are screen grabs of images that are on phones. So the first one shows, and these are different scenarios that someone can connect to a volunteer. Once again, this is the first level of Be My Eyes, a blind user connecting to a volunteer. First image shows an individual trying to get some support with an electronic device or an appliance. The second example shows an individual about to find an elevator, right? And it's the concept is, an individual who is blind or low vision can connect with someone to help them get some understanding if they're in an unfamiliar surrounding. The third picture shows a set of keys that are on bricks on the ground. And it can be used, Be My Eyes can be used to help someone if they've dropped something or they're trying to find something on the ground or find something in a room. The fourth example shows a picture of some text on a phone. And the example talks about, if someone needs help reading print. The third example shows a collection of clothing with different colors. I'm sorry, that is the fifth collection. I'm sorry, but my counting's off this morning. The fifth image shows some different colored clothing on a screen, where someone can get help with colors. And the sixth one shows a collection of canned foods and really trying to get some help differentiating products in the household, whether it be food or supplies or merchandise or items. These are great examples of how an individual, if they have Be My Eyes on the phone and they need some help in a pinch, they can simply just connect to the next random volunteer and get help with it. So Be My Eyes was initially built out. It was originally created in Denmark. Microsoft and Apple actually got behind this and helped really blow it up and build it out into the technology today. So that's the first level of Be My Eyes. The second level of Be My Eyes is called specialized help. On the screen, I have the Be My Eyes logo, and I have some of the Be My Eyes specialized help partners. We're included on here, but some of the other ones include the National Federation of the Blind, Procter & Gamble, Google, Verizon, etc. There's about 12 logos on the screen. So we are the healthcare partner for Be My Eyes in this specialized help section. So I'm showing, so on the screen, there's the visual components where someone can connect to a volunteer. And there's also an icon on there where someone can browse specialized help. Obviously, all of this can be done through VoiceOver as well. So I have 4 different screen images on here. This is like screen images of what would appear on a phone. So the first thing is get live video support, call a volunteer, or browse specialized help. When someone goes to specialized help, there's a directory. Someone can browse for assistive technology, beauty and grooming, blindness organizations, careers, food and beverage, games and toys, home cleaning, other, personal health, and technical. We are in the personal health category. Click the personal health category. There are currently 6 options. This is changing. They're always adding new partners, but someone can connect to accessible pharmacy and our pharmacists and our healthcare professionals. There are a few Procter & Gamble products on here, like Clear Blue, which is a women's care products, Crest toothpaste, or Oral-B if someone needs dental oral hygiene support. There's an insurance group on here, MHS. And then there's also the state of Ohio runs a program. We actually run this for the state of Ohio. The state of Ohio provides this for anyone in the state of Ohio who needs support with COVID testing. Those calls come to us and we support people with COVID testing. Now, that being said, what we use Be My Eyes for is to support individuals with home COVID testing, with home pregnancy testing. We help women who are blind do home pregnancy tests. We help people identify pills. So if someone drops a pill, for example, to help identify what that pill is, or help find that pill. And obviously, all these things can be done with a random volunteer. But when you're dealing with health situations, you're better off dealing with a healthcare professional than some random volunteer, even though that random volunteer may have the best of intentions. If someone needs training on a glucose monitor, or identifying a pill, or identifying a side effect, or being trained on how to, or filling a liquid measurement, it's better off coming to a healthcare professional. So we work with individuals to help them with that. So that's the second level of Be My Eyes. So there's the consumer, one-on-one volunteer. There's the specialized help section where we support individuals, as a healthcare provider to a consumer. And then there's let me go. I'll call it the business to business, for lack of a better term. For you, healthcare providers who are going into people's homes, we can download Be My Eyes onto your phones. And when you're in the home with an individual, if depending on your certification, you're not allowed to support or help someone with their medication or touch their medication, or they just got a new medical device and they're a little confused about how to use it. You can pull us into a conversation with that individual, and we can actually be involved in that conversation to train them on how to use the device, help them identify their medication, guide you and them about taking the medication properly, and really be a support role, play a support role for you when you're in the home with the individual. They also answer questions, properly about diabetes. We can pull in one of our diabetes specialists, or about a pill, or about a side effect, so on and so forth. The fourth level of Be My Eyes is it's pretty cool. And it was actually just launched recently. We were involved in the beta test for it. This is artificial intelligence. It's very science fiction like. Actually, now, it's been for about a month now, it's on the iPhone version of Be My Eyes. We're still working on trying to get the kinks out of the Android version, but that'll be coming out soon. And this was built by Be My Eyes, Microsoft, and OpenAI. And obviously, we hear a lot of buzz in the world today about like what is artificial intelligence. I still don't understand it. But what I'm going to do is I'm going to demonstrate on my phone an example of the artificial intelligence for Be My Eyes. Now, I don't have my voiceover on, so I'm going to take a photograph and then I'm going to explain what's on my phone. But essentially, what it's able to do is take a photograph of what's in front of a person, whether that be what's in the room, a product, some text, and it can, with meticulous detail, explain to that individual what's in front of them. Now, we were involved in the beta test because they wanted us to ascertain what this could be used for healthcare. And while we're not necessarily completely comfortable making recommendations, we were hoping you'd be able to identify liquid measurements or explain or train people on how to use certain devices or technology, or even identify certain things. It's still a little imperfect. But I'll demonstrate it for everyone. I'll give you a case study about how it can be used currently, but also let you know that like within 5 years, this is going to be like, an analogy would be like dial-up internet versus high-speed internet. Currently in the dial-up internet phase. 5 years from now, a lot of these kinks will be worked out. And when this is in full stride, this is a complete game changer for individuals, and for an individual who is blind, but for anyone. We're starting to recommend it for people who are blind and low vision, and also people who have some cognitive disabilities, who need an understanding of what may be in front of them in a room or in a situation. All right, so without further ado, so I've opened up on my phone the Be My Eyes app, holding in my hand. By the way, I'm sitting at a desk in front of my computer. I'm holding in my hand a can of tomato sauce from ShopRite in Philadelphia. And so what I'm going to do is I'm going to take a photograph of tomato sauce. I'm holding the can in front of my computer. I'm holding my phone up in front of me, and I'm taking the photograph. It takes about 15 seconds to process the photograph. All right, so it now just popped up. And like I said, if my voiceover were on, it would read this out loud, but I'll explain what it says. It says, the picture shows a hand holding a small can of tomato sauce in front of a laptop keyboard. The label on the can has images of tomatoes and reads tomato sauce. It also indicates the net weight as 8 ounce or 227 grams and has a green color theme. There is a QR code on a sticker on the laptop, and the text says scan and mentions reviews, videos, features, specs, and support. Now, an individual can drill deeper. So I can ask it more questions. So I'm going to ask it the question, what vitamins are in tomato sauce? So it's processing that question. So imagine this, it's still a little loose, but imagine someone, are there vitamins in tomato sauce? I ask the questions, are there vitamins in tomato sauce? Tomato sauce typically contains vitamins, especially vitamin C and vitamin B vitamin and some vitamin B vitamins. However, for specific vitamin content, it's best to check the nutritional label on the can. If you need some assistance, please take a picture of the nutritional label or contact a volunteer. So an example here is what we've been using it for is imagine someone who has diabetes or someone needs to manage their carb count. While it will not take a photograph of a plate of food and identify the exact carbs in there, what it can do is identify if the food is high in carbs. So for example, if I took a picture of a plate of food in front of me and I asked it like, okay, which of these foods are high in carbohydrates? It may say, hey, that chicken breast that's on your plate is not high in carbohydrates, but it may be high in protein. The mashed potatoes are high in carbohydrates. So it can help someone identify who is still learning about carbohydrates, which of the foods are all there. There will be a point in the future when that will get, as I mentioned, more science fiction like, and be able to meticulously detail carbs and really help guide someone who is managing their carbohydrates, what they're going to be eating, and what may have high or low carbs. All right, so that's the Be My Eyes app. It's a free app to download. It's an invaluable tool that we use to support individuals, that we recommend to individuals to help themselves, that we recommend to people like you who are going into the homes of individuals about how we can partner with you to help you support an individual. And I encourage you all to try the artificial intelligence stuff. It's a lot of fun, but it'll also like give you some ideas about how this can be an invaluable tool for individuals in the blind and low vision community. So I'm about to pass the microphone to my business partner, Jason. Jason has his doctorate in pharmacy. And he actually leads our healthcare team and our pharmacists in really figuring out how we can be the most accessible and supportive to individuals. Jason's going to speak about glucose monitoring and the importance of glucose monitoring. He's going to give like a glucose monitoring 101, but really like the punchline of everything he's talking about. And there's so many things he could be talking about when it comes to diabetes. We could be talking about nutrition. We could be talking about exercise, talking about insulin and insulin injection and managing insulin and the accessibility and challenges of insulin. That's a topic for a completely different day. Today, we're really going to focus on glucose monitoring, glucose counting, and the biggest dynamic is the game changer of technology that has occurred in the last few years, which are continuous glucose monitoring systems. It's important that we all learn about these things because individuals who you're working with who are glucose dependent, who are insulin dependent, continuous glucose monitoring systems are a complete game changer, specifically for individuals who are blind. So I'm going to stop talking. I'm going to pass the microphone to Jason. And he's going to speak for about 15 minutes or so. And then we'll continue the conversation with some other things that we're doing to support individuals in Pennsylvania who have diabetes, who are experiencing vision loss. So Jason, take it away.
Andy, thank you so much. I want to thank everybody for taking the time and spending it with us today on this Zoom call. Glucose is critical to the healthy functioning of our bodies. I think a lot of times when we think about glucose in general, it in relation to diabetes type 1 or type 2, it's seen as a negative. And the reality is that glucose fuels our cells, it's energy for our bodies, and it is important or necessary. Glucose levels naturally oscillate through the course of the day, but it's the extent of the fluctuation that really matters. High glucose variability or unsteady blood sugar levels are associated with all kinds of metabolic dysfunction, diabetes, and cardiovascular complications. Something to think about is both high and low blood glucose levels can be detrimental in the long run. So while diabetes, both forms of diabetes, are most often associated with a very high glucose level, as soon as we understand that the patient has the need to be monitored this way, or that glucose is a challenge for them, it's important to understand that there are limits on both sides of what is acceptable. So you can have very high glucose and you can have very low glucose, and both are detrimental. Our glucose levels function to sort of act as a stream of information that offers insights and a snapshot into our overall health. So it is extraordinarily important to understand glucose, both in terms of what it is doing on the positive side, but why high glucose in relation to diabetes can prevent or can really manifest in physical challenges for patients. So I want to talk a little bit about home glucose testing. Self-monitoring of blood glucose has been described as one of the most important advancements in diabetes management since the invention of insulin in 1920. And monitoring glucose by a patient is considered the most important self-care procedure in diabetes type 1 and diabetes type 2. Now, the frequency for which patients with diabetes should monitor their blood glucose levels varies from person to person. But most people agree in the medical community that insulin-treated patients should monitor their glucose level at least 4 times a day, most commonly when fasting, before meals, after bed, in relation to exercise and diet. So it's really important to conceptualize that for people who are using insulin, it's recommended to test 4 times a day at a minimum. And in periods or times when patients are experiencing high fluctuations in their glucose, they should probably test more frequently. The other thing to keep in mind is that if you're a newly diagnosed patient with type 2 diabetes, where you're not yet required to use insulin, understanding what your personal journey is and the effects of nutrition, exercise, and your particular lifestyle have on your blood glucose is also important. So at the beginning of a newly diagnosed patient with type 2, there is likely to be an awful lot of testing. One of the things that we've sort of touched on earlier, and it will continue to be a theme through this discussion and many others, is that diabetes is the leading cause of blindness in the United States. And from a functional perspective, if you have diabetes and your blood sugar is often high, it can lead to damage to your eyesight. So you have sort of the dual process of thinking, how do we prevent disease progression and how do we assist patients who are already visually impacted? So it's incredibly important to keep that in mind when you're thinking about exactly how to go about assisting patients with their glucose testing and monitoring, but also mechanisms to provide the least amount of variations and challenges to those patients. So the goal of glucose testing and monitoring is to collect detailed information about glucose levels at many time points to enable maintenance of a more consistent glucose level by more precise regimens, treatments, and lifestyle modifications. It can also be used as an aid in the adjustment of the therapeutic regimen in response to blood glucose values and to help individuals adjust their dietary intake, their physical activity, insulin doses, and basically all of their sort of healthcare treatment regimen to improve glycemic control on a day-to-day basis. Facilitating the development of an individualized glucose profile that can guide healthcare professionals in treatment planning for an individualized diabetic regimen is a key facet of glucose monitoring and testing. So really, we all understand that seeing your primary care physician or even an endocrinologist, a specialist who would treat diabetes, is not the kind of thing that takes place very often. I think most of us would probably see our GP 1 or 2 times a year, and maybe more often if they were feeling ill or otherwise. But the reality is, a patient can assist and participate in their own sort of healthcare journey by monitoring and testing appropriately every day. So giving people with diabetes and their families the ability to make appropriate day-to-day treatment choices in diet and physical activity, as well as insulin or other agents, has a profound effect on the success of their care. Because really, for a diabetic, you become the leader of your own healthcare regimen and your own healthcare journey. Testing and monitoring is the most essential tool in providing what we would call the greatest opportunity to affect the overall success. The other thing to keep in mind is understanding the relationship of your blood glucose to how you feel improves the patient's recognition of hypoglycemia or of a low blood sugar and severe hyperglycemia or very high blood sugar. This is crucial in avoiding episodes of those really low and really high glucose, because the ramifications of these events can lead to prolonged hospitalization and lasting physical issues. You know, there's this discussion of patients being sort of dizzy and in poor cognitive state because their blood sugar is so low. If they're not monitoring their blood sugar after they've eaten or chosen a different sort of dietary selection, or if they could potentially have used too much of their medication or over-exercised, can lead to some really significant ill events. A patient with low blood sugar can fall down a flight of stairs. They can pass out when they're walking on the street. And if they're visually impacted, you can imagine how even more significant it is to help them gain control. Enhancing patient education and patient empowerment regarding the effects of lifestyle, diet, physical activity, and medications on glycemic control supports the overall health benefits to patients with diabetes. It's an important thought process from the perspective of what patients deal with mentally when they have the diagnosis, that they can be part of the solution. They can affect change in their own diabetic situation, and they can really advance their own care. And monitoring and testing is the primary way to achieve that. Another thing to consider is that diabetic testing and monitoring has a proven track record of the reduction of secondary disease states. So I mentioned earlier that it's important to have blood sugar in your system to provide energy for your cells, to give yourself all of the proper environment to operate on a daily basis. But consistently high blood sugar over time leads to a number of secondary disease states that are of particular concern: kidney disease, heart disease, stroke, and certainly blindness. All of the organs associated with these disease states do not fare well in a high blood glucose environment. Andy, can you go to the next slide, please? So traditionally, home glucose devices test blood glucose. So it's looking for the measure of glucose in the bloodstream. This is a multi-step process. So before you test your blood sugar, you have to prep your area, which is usually a fingertip. So you're using an alcohol swab that needs to be opened, the area swabbed prior to any finger prick. So a skin pricking device is utilized with a small lancet. So think of it the way you would have a clicking pen, only the spring in this case is not designed to sort of eject the pen tip, it ejects the finger prick. So you have to take that finger prick out of a box. You have to unscrew the tip of the lancet device, load the lancet, screw that back, prep your area, make sure the alcohol is dry, put the lancet against your finger, hit the button, which then produces a drop of blood. At that point, you have to take a strip from a canister, a small one the size of, say, a lipstick, and you have to hold that strip up to your drip of blood without contacting it with your skin or any other kind of residual alcohol that may already be on your finger. The strip needs to be free of dust, dirt, and certainly blood from a previous test or any other kind of fluid that's on your finger like alcohol. Recognize the condition or the sanctity of the strip is incredibly difficult to those with visual impact. There's an amazing amount of dexterity required to do this properly for those with full use of their eyes. I'd say that anyone on this call right now doing this for the first time would be challenged by the procedure and in fact have difficulty and needs a certain amount of training and repetition to get it done. So you can imagine what that challenge is if you don't have reasonable vision and the ability to see everything that I just described. There is a high risk of contamination. And if you've contaminated any part of this, you're not going to get an accurate reading. The downside to that, obviously, is not really understanding what your blood glucose is, but also the potential to report a number that is not accurate and then react to that number in terms of your physical activity, your diet, your exercise, and certainly your medication regimen as well. In the blind community, in low vision community, there's a heavy assistance footprint in terms of utilizing a traditional blood glucose monitor and all of the steps that go along with extracting the right amount of blood and using the device properly. So you can imagine now a patient who's, living with visual impact is going to feel potentially a little bit less independent when you need to rely on others to train. And then certainly if there's any kind of missed or incorrect monitoring that would lead to some actions in the wrong direction, that's going to have an effect, not just on their success, but also on their mental well-being. Andy, let's go to the next slide. So on to the continuous glucose monitor. Well, the continuous glucose monitor measures the glucose in the interstitial fluid. Okay, so that's something that probably isn't ringing a bell right away. The interstitial fluid is the liquid that fills the space between the cells. It's made up of water, amino acids, sugars, fatty acids, enzymes, hormones, salts, and a whole bunch of other cellular products. The interstitial fluid surrounds and bathes all the cells of the body, and it's responsible for bringing oxygen and other nutrients into the body cells and helps to remove waste products from them as well. So your interstitial space and fluid is a little bit easier to reach than your blood. At the same time, there's a much larger volume, and your interstitial fluid reacts to sugar a little faster than your blood supply does when you ingest, digest, and put the glucose into your blood. A continual glucose monitor utilizes a pod sensor that is applied to the skin on the back of the arm or on the abdomen to provide continuous glucose measures from this interstitial fluid at all times. So there are no finger pricks. There are no strips. There's a pod sensor, and that pod sensor can easily be applied to an area. The two that are most popular, well, we're going to talk about in a minute, are the Libre and the Dexcom. Each of these comes with a simple mechanism to apply the pod, and it's very easy to recognize if it's on you properly. So you're experiencing a continual measurement, not a snapshot. And this is being communicated to a smart device or a device provided by the manufacturer so that you can read your sugar at any given moment within an instant, as opposed to going through the procedure that we spoke of earlier of swabbing, pricking, dripping, and putting that strip into the device. The continuous glucose monitors have extraordinary benefits for the blind. They, as I said, they can report not just to a smart device, but to a secondary destination as well. So your chosen caregiver can also be monitoring your glucose, or a family member. Just imagine this. You're being monitored continuous, and you fall asleep, either because you're tired or maybe your blood sugar's low, and it dips or it spikes. But you're not awake to understand that. That pod can be sending detailed information to someone else that can assist you in that particular time. It can also speak to Alexa. And we, in fact, at Accessible Pharmacy Services, created an educational video with the University of Pennsylvania to show exactly how this will function. Let's go to the next slide, Andy. So when you think about it, the benefits to a diabetic who is blind is extraordinary. You're cutting out a huge process as it pertains to the actual utilization of the device itself. You are removing blood and blood contamination from the procedure overall. Just the fact that you do not have to prick your finger is really a fantastic innovation for anybody, because if it were me, I wouldn't want to do it 10 times a day either. But in the same respect, I have fair vision. And I've done this 1,000 times because I'm a medical professional that's been a diabetes educator, and I understand it. It still is not something that I would choose to do if there were an easy alternative. If I were compromised in terms of my vision, I would certainly experience an even greater challenge, and I would be less likely to get the appropriate measure. The glucose measure is always on demand. So at a given moment, prior to entering any restaurant, prior to entering any form of exercise or any other activity that would be, energy requiring, I will know what my blood sugar is, and I can adjust from a medication perspective or even a dietary perspective to what my glucose is at the moment and what my expected activity is. You have access through Siri, through Alexis. This, as we've said before, talked about AI a little bit, is the precipice or only the beginning of how we can utilize smart devices, artificial intelligence, and read-react systems on a continuous basis. At Accessible Pharmacy Services, we are extraordinarily well-versed and trained in continual glucose monitoring. We can troubleshoot all of the devices through a BIS, as Andy went into detail earlier, but we also have trained professionals that can provide support at any given moment for better utilization of these devices. And our coaches like Lynn can provide really, really excellent information as to how patients can go about minimizing their exposure to high or low blood glucose levels and the ramifications of those events. There's just a much greater likelihood that the patient will stay in good control, reducing the risks of both low and high blood sugar. So in essence, the continual glucose monitor is an absolute game changer as it pertains to patients with low vision and who are blind. The most popular models are the Dexcom and the Libre. Andy's got visuals of them up right now. As you can see, the pods adheres to the patient's arm or their abdomen, and you can see the blood sugar shows up immediately on the smart device. It is an extraordinary advancement. It is, in my opinion, the primary mechanism that anyone with visual impact or blindness should be monitoring their blood sugar. And at Accessible Pharmacy Services, we fully support the utilization of these devices and the patient's understanding of how to go about the best mechanisms to monitor, control, and live better with high blood sugar and diabetes. I want to thank everybody for the time here today. I'm happy to provide any clarity if we want to do that at the end of the discussion, but it is really a significant advancement, and we're very happy and proud to be able to support the community with utilizing these devices.
All right, thank you, Jason. Thank you. So before I pass the microphone over to Lynn, just to summarize what Jason was speaking about. So first of all, the two images that are on the screen right now show the pods applied to someone's arms. They're essentially the size of almost like a nicotine patch. There's the pod, I forget what it's called, like the facilitator, the thing that attaches the pod. And there's also a photograph of a woman viewing her smartphone that, if her accessibility features were turned on, would read the blood glucose level out loud. The second thing we want to emphasize is that if any of you are in the home of someone who is just getting a device for the first time and you need help setting it up, or they need help troubleshooting it, or if you have questions, engage us through Be My Eyes, or one of our diabetes specialists or one of our pharmacists will hop on and help you troubleshoot, help train, and help get everything set up. Also, the video that Jason was referring to, it's in the PowerPoint slides that Jamie has to share with everyone. It was an educational program that we did with the executive director from University of Pennsylvania's Diabetes Education Center. And it really broke down in greater detail the devices, their functionality, how insurance plays a role in them, their accessibility features. So I encourage you to check it out. It's about a 45-minute video, but it's very insightful, very educational. All right, so now to move on to the next topic. All right, so we're going to speak about the National Diabetes Prevention Program. And before I pass the microphone over to Lynn, and Lynn, I'll give you a quick overview of Lynn. She'll tell you more about herself. But the background of this is we were contacted in the spring by the Center for Disease Control. Centers for Disease Control and Prevention, CDC. The CDC developed a program called the
Excuse me,
National
I wanted to
Diabetes
let you know
Prevention
that
Program.
I don't need you to get Trapper today.
The National Diabetes Prevention Program, which is basically a community-based program, which is designed to help individuals who are at high risk for diabetes about how to live a healthier lifestyle, how to eat healthier foods, how to manage your diet, how to be more physically active, how to lose weight, and how to reduce the likelihood of diabetes. Similarly, we're finding that we kick this program off, we have individuals who have diabetes now who also benefit from the program about how to learn how to eat healthier lifestyles, how to be more active, how to lose weight, which ultimately benefits them in managing their diabetes better. So we were contacted by the CDC. They mentioned that they have, healthcare groups, individuals nationally. They've got 3,000 programs like this nationally. It occurred to them that they have no one who is blind teaching the program. And while, as we mentioned, diabetes is the leading cause of blindness, they came to us and they asked us if we could help take some people from our team and have them go through the CDC training to become diabetes lifestyle coaches and lead these programs. And so the punchline to that is there are two women who work with us, Lynn being one of them, who are blind, who have gone through the training and are now certified diabetes lifestyle coaches and teach these programs. And Lynn will describe the programs to you virtually on Zoom. And we're one of the few groups in the country who are allowed to do run these programs virtually. And so not only do we have individuals who are blind leading these programs, and by the way, you don't necessarily need to be blind to be part of the cohorts, but we find that the ability to provide this virtually on Zoom, it's a Zoom program, is pretty incredible and accessible. Before I officially pass this over to Lynn to speak about, we are also, the CDC was so excited about what we're doing in this space and the initial feedback that we have. We have 2 different cohorts running right now. We're launching others starting in February. We are also training someone from our team right now who speaks sign language. And so in February, we're going to launch cohorts that are also taught in ASL virtually. We're going to be the only group in the country who are going to be doing that. So we're very excited about being able to provide that service as well. All right, I'm really done talking now. I'm going to pass the microphone over to Lynn Heights. For those of you who know Lynn Heights, she wears a lot of hats. I'll let her tell you about the hats, but she's a rock star. We're very grateful to know her. We're really lucky to be working with her, and the work that she's doing with us, with individuals in the state of Pennsylvania around diabetes management and pre-diabetes prevention is pretty incredible. So, Lynn, I'm going to put myself on mute. I'm going to pass you the microphone so that you can talk, and I'm going to just ride through some slides here, and I'll try to sync the slides to what you're talking about. So thanks again, Lynn.
Okay, so good morning, everyone, and it's really great to be here. Some of you I know, some of you I don't know. I actually worked for Blindness and Visual Services for a number of years and was the district administrator for the Philadelphia district office for, just a few years. I am blind and I am a certified diabetes lifestyle coach, as Andy said. And, I do wear a lot of hats, but this is probably my favorite hat to wear. So the diabetes prevention program, as Andy said, is sponsored by the Center for Disease Control. And it does have proven success. So people under the age of 60, this program has prevented them from developing type 2 diabetes by 58%. And individuals ages 60 and older have lowered their risk of type 2 diabetes by 71%. So that's like a really big deal. There are some individuals that will end up developing type 2 diabetes just because of genetics. But the fact that this program can push that that number out to when someone is older, maybe help to reduce the effects of the type 2 diabetes is really, really awesome. So the goals of the program are to lose weight through healthy eating, to increase physical activity, and to learn and identify the barriers that we all have to healthy eating and physical activity. And, it's the barriers are what's really important, because some of those barriers are lifestyle barriers, and it's actually changing, what your lifestyle is in order to reduce the risk of type 2 diabetes. So the program is a 1-year program. As Andy said, it is run through Zoom. There are 22 sessions. And so for the first 14 weeks, we meet once a week for about a half hour, 45 minutes. And each week we have a topic, we have discussion. The individuals that are participating in the program share their information. Some share some supports that they've identified. And then we share those out with the group. We are supportive of each other as we go through the program. And so it's really, really awesome. After the first 14 weeks, we go to every other week for a couple weeks, and then we go to once a month for the last 6 months. The weight loss goal is 5 to 7% of your initial weight when you started the program. And, some people get to that 5 or 7% in the first 6 months, and some people don't. But that's okay. That's okay. The whole point is that you're learning about what your lifestyle is and how to make that lifestyle better so that you do not end up developing type 2 diabetes. The program is funded by insurance, so there is no cost to the participant for participating in the program. One of the things that the individuals do need to do is they do need to report on a weekly basis what their current weight is. That information is shared then with the CDC and goes into their statistical data for the program. So who can participate? If you have to be 18 years of age or identify with one of the following things. You're either overweight, over 45 and older. If you have a parent or a sibling that has type 2 diabetes. If you're physically active less than 3 times a week. If you have a history of having a baby that weighs more than 9 pounds, if you have developed gestational diabetes while you were pregnant, and if you are African American, Asian, Pacific Islander, or Native American. So we talk about we have different topics for each session. We talk about how to get active, when to get active. We talk about counting calories and carbohydrates, how to calculate what your calories are that you're taking in versus the amount of calories you're burning through physical activity. We talk about dealing with stress and coping with triggers and lots of other things that really feed into an individual's potential to develop type 2 diabetes. So that's really about all I have. Oh, we do invite you to send individuals our way for the program. As Andy said, we are looking at starting another couple cohorts in February. And so the way you could do that is when you meet with a customer, and I know that, you know, everybody, you have to take in the medical information. You identify that, you know, they're diabetic or they're pre-diabetic. If you get them to sign a release to share the information about this program with them, you can then share that release with us, and we can contact the individual. We will do the intake. We will get them set up with a group, and you know, away they go. So, you know, that's really about all I have about the program. The group is very supportive of each other, and it's just a really, really awesome program to be part of.
Awesome. Thank you, Lynn. So I'll add a few things to what Lynn said. That was awesome, by the way. So Lynn is one of our coaches. Marianne Grignon, I don't know if anyone knows her. She's from the Allentown area, who's used OVR, who's a beneficiary of the OVR. She also teaches the course. Also, Lynn, as I mentioned, Lynn wears a lot of hats. A hat that she omitted was she's also the Pennsylvania president. She's the president of the Pennsylvania affiliate of the National Federation of the Blind. So there's also a way for us to collaboratively, you know, reach out to the broader Pennsylvania blind and low vision community. A few other things about the program. We received a grant from the Center for Disease Control. Anyone who's participating in the program, whether they have pre-diabetes or they have diabetes, if they do commit to the program, we are able to send them a talking scale, bathroom scale, so that they can manage their weight, monitor their weight, and report their weight. We're only collecting data for the CDC for the people who are pre-diabetes, but anyone can get the scale. Lynn mentioned the registration, the sign up. First of all, anyone here can also join as well in February. I've been a fly on the wall. I've been participating in the program myself. I've lost 4 pounds already. But it's also just pretty fascinating. It's interesting. I'll share a quick story. There's someone who works for us who was blind. He lost his eyesight due to diabetes. He was diagnosed with diabetes about 20 years ago. And after being shown how to prick his finger and monitor his glucose, he was handed a bunch of brochures and told that he needed to cut back on sugar and exercise more. And that was the extent of the knowledge he was given. And unfortunately, fast forward to today, he is completely blind, in total darkness. He has issues with his kidneys. He's on dialysis. He's waiting for a kidney transplant. He's had a heart attack. He's having issues with his fingers and his toes. These are all diabetes-related complications. And it's not to say that he wouldn't have these complications, but he would be in significantly better health had he been given some of the knowledge that's being shared on these programs. And as Lynn mentioned, it's completely covered by insurance. There's no cost for an individual. Even individuals that are not covered by insurance, we invite them to join the program. That being said, let me go to the next slide. And Jamie can share this information with everyone. She has a copy of this PowerPoint. This is a resource slide. So there's a link to download the Be My Eyes app, where you can download it on both the Android and the iPhone. There is the video, the recording of the webinar that we did with the CGMs, the continuous glucose monitoring systems, with the University of Pennsylvania, which you can share with a patient, a customer, or for your own knowledge. We have the CDC Diabetes Prevention Program enrollment. It's very simple. It's a 30-second enrollment form, which is essentially also functions as that release. All we need is the information. We will jump in and enroll the person and get them all set up. If you have a customer who would benefit from our services, there's a new patient form. On the simplest level, we just need their name and some contact information, and we'll jump in. Obviously, the more information that you can give us about them, the better we can pair one of our healthcare providers with them. And there's a link to our website. And finally, there's a few other really quick things. we are actually working with the state of Pennsylvania. We are launching a program this summer to employ blind college students who want to pursue careers in healthcare. And so they're going to be involved working with us this summer. They're students who enrolled in colleges and universities in the state of Pennsylvania who are blind and low vision themselves, who want to learn about healthcare and be in the healthcare field. At some point, we would love for a few volunteers here to reach out to us and let us know if you'd be willing to speak for like, just 10 minutes with these students, just to give them some insight into your experience about how you support blind and low vision individuals in the state of Pennsylvania. Also, we spoke about our packaging and labeling. If anyone would like a sample kit of our packaging and labeling, please email us at info@accessiblepharmacy.com. We'll send you a kit. We can jump on Be My Eyes or hop on a phone call or in a Zoom call, walk through all the packaging and labeling with you, help you get set up so that you can demonstrate for your customers how some of the talking medication labels work, how some of the packaging works. Obviously, once again, with Be My Eyes, if you're with an individual and you want to connect with us for training around diabetes or medication management, please get in touch with us. If you have questions offline about the diabetes prevention program, reach out to Lynn or me, or just email us at info@accessiblepharmacy.com and we'll jump in with that. And finally, as I mentioned, we will be having in February, being able to provide a cohort for those of you where it's relevant to the customers you touch. We'll be able to provide the diabetes prevention program in sign language as well. If the individual needs a talking scale, we can have it delivered to their home to help them manage their information. And that's it. So I'm gonna stop speaking there. If anyone has any questions, we're gonna open up the floor to questions here. Jamie has all of our contact information. She has a copy of this PowerPoint presentation. You can email us at info@accessiblepharmacy.com. Our website is accessiblepharmacy.com. Jamie, thank you again. This is awesome. We really appreciate it. We've had some other conversations with everyone here. So there's one, but now that everyone's going back into homes, now that the pandemic has subsided, we're so excited about the things that we can do to really benefit Pennsylvanians. One final thing before I start digging into questions. We also do work very closely with the Pennsylvania Department of Aging. So if it's relevant for the customers who you're touching, the PACE program, those of you who aren't familiar with the PACE program, it's the Prescription Assistance Program in the state of Pennsylvania. It's funded by the Pennsylvania Lottery. If you have customers who you touch who would benefit from that program, contact us. We can actually work with the state of Pennsylvania to intervene and get that person set up in that program. And it basically would cover copays, cover things that aren't necessarily covered by insurance, and so on and so forth. So Jason, there's a question on the screen right now. How many days of medications are sent at a time with packaged medications? When you do 90-day supplies, how do you handle medication changes for people who get packaged medication? So on the highest level, there's a few questions here. One is, what does the patient prefer as far as when they get shipped? Second way to answer that is, quite often it's dictated by the insurance company. If the insurance company will let us deliver medication that's delivered in 90-day supplies, we're comfortable doing that. We pay for the delivery. So there's a financial benefit for us to deliver 90 days at once. That being said, we provide automatic refill management. And so for someone that gets their medication pre-sorted in some of the accessible packaging, if their medication is changed regularly, it's probably better for us to ship them 30-day supply, knowing that we would have to change it again potentially the next month, and just do that automatically. If in mid-month or collection of meds, a person has a medication switch, we would automatically deliver that medication to that individual once it gets to us. And using Be My Eyes, an individual, a customer can contact us. We can go through reorganizing their medication with their new medication dosage to make sure they stop taking the old medication properly and start taking the new medication properly. And the next month, when they're due for their next medication, it would just automatically be recalibrated in their packaging. So I hope that answered that question. There's another question here. Let me open these questions and make them. This is from Caroline. The biggest barrier with customers has been the reluctance to change anything related to the current pharmacy. Oh, preaching to the choir. Even approaching the subject, I have found that people become anxious and worried. Any
And-
ideas about how to best approach this?
Can I add a little to this?
Oh, the previous question or this question?
This one here.
Okay, sure, please.
So, Carolyn, the one thing that I can say is that the level to which we support and the materials and resources that we have to offer that are value-based with no extra expense to the patient is really the way to approach it. And here's what I mean by that. Most people have faced some challenge with medication management, and that's with or without regard to their vision. Those with visual impact obviously have even greater challenges. And when they see and understand what we have to offer, especially if they're involved in a coaching program that we offer with Lynn and our other associates, they understand the connectivity to better health and more resource utilization. So there's really no downside to contacting us and understanding better what we can provide and seeing the packaging that is not available at, I would say, 99% of the pharmacies in the country, speaking to the individuals who have been trained specifically to speak to people in this care category, knowing that they're expecting the phone call, not dreading the phone call, will make a difference. So when you approach this with someone, I guess the best, pitch, for lack of a better way to put it, is like there is more that you can get from these folks without paying any more than your current circumstance. And you can, in fact, switch back if this is not a good fit for you. We want everyone to be happy with us, and we want people to do better because of being with us. So it's really a matter of there's more available, there's more included, there's more specificity as to how we go about helping folks like you. And there's really no limit, or shall I say, no downside or risk, because we can always facilitate in switching you back if it's not something that works.
I want to build upon what Jason said. And Jason, that's actually one of the things I was going to mention, which is we would argue, encourage the patient to try us out. If at a period like 3 months down the road, they're like, yeah, you know what? I like it when my niece goes to CVS and brings it herself and organizes it for me. That's fine. All they need to do is call us and we will transfer everything back to the old pharmacy and we will alert all the prescribers so they know. In an extreme situation, if you hit a brick wall where you know a patient would 100% benefit from these services, you're absolutely reluctant. And I don't want to like do this all the time, but if you have an individual like that, reach out to me. We can send the person like a month supply, like for free, of like a multivitamin. Say, all right, we're going to send you a multivitamin. We're going to put it in a package and we're going to put the talking label on it. You're going to get it delivered. You're going to see the delivery. You're going to experience the packaging. You're going to experience the medication management component of it. You're going to experience a talking label or a braille label, whatever it is that. And make the person a little bit more comfortable. So in the event of an extreme situation, if you have someone who's extremely reluctant, but you know that they need this service, reach out to us and we'll send them like a 3-month supply of a multivitamin, just so that they can experience the process and feel a little bit more comfortable embracing the program wholeheartedly.
So Andy, can I add something to that?
Oh, sure.
So I actually use the service. I've been using it for 3 years, and every 4 weeks there's a box that shows up on my doorstep. I never have to go to the pharmacy. I never have to worry about picking anything up. I don't have to worry about the weather or is Uber going to come or whatever. The other thing is that my husband, who is sighted, also gets his scripts via accessible pharmacy. And what's really great about that is he has a heart condition, and if something would happen and I would need to dispense his medication, it's already pre-sorted. I don't have to try and figure out what his 7 different bottles say. And many of us who are blind are, we have spouses or we're caregivers for older adults. this is like an invaluable service. So, yeah, I mean, that would be another way that you could approach it with a customer.
Oh, I'm glad you brought that up, Lynn. Thank you. Just to make sure everyone understands, when an individual joins us, we can actually provide everyone's medication in the home in an accessible format. So, for example, if an individual is a Braille reader, for argument's sake, we can label everyone's medication in the home in Braille. That way, regardless of who opens up the medicine cabinet, you know exactly what everything in the medicine cabinet is. And so, while obviously our core competency, our core focus is working with patients who are blind and low vision, we obviously also support others in the household. We do work in the deaf community, in the paralysis community, in the neurodiverse community, refugees and asylum seekers. The common denominator amongst each of these populations is they each have their own barriers to access to managing their healthcare independently. And so everything that we do is about figuring out, like, when we work with a household, what's going on in that household and what collection of things do we need to do to support everyone in that.
Yes, fuck.
Anyone else have any questions?
Hey, there's a question about intermittent usage. So for patients who would receive an antibiotic or otherwise, we can certainly facilitate that for them. It may take overnight usually to get that to them, but we will help them manage to get that prescription from a more local pharmacy if there was something that was sort of intermittent or emergent. So aside from the fact that we're, packaging and labeling prescriptions and we're communicating with folks and providing education or otherwise, we also do provide what I would call a level of navigation, so that if a person were to need an assistance with an emergent prescription, and I see that there's another prescription or another question about controlled or narcotic prescriptions, it would sort of be the same circumstance. So you probably can't wait for something because you've had a dental extraction overnight. You don't want to wait to get your antibiotic and your pain medication. If you have a simple procedure where you've been discharged from a short stay unit, or you've had, in some kind of, a lump taken out or a mole removed, and you have a short-term pain medication, that should absolutely be filled at a local pharmacy. If you'd like us to assist with that, or if more importantly, you want to know if it interacts with your drugs, we are always able to have a conversation with you and assist in the navigation of that.
Yeah. I'll give a real example of that. Thanks for bringing that up, Jason. About a year ago, I woke up with strep throat. I knew it was strep throat because I get strep throat every few years. I know exactly what it feels like. I contacted my physician. I set up like an 8:30 in the morning telehealth appointment. I explained to her my symptoms. She confirmed that it was most likely strep throat. And she asked if I wanted an antibiotic. I said, yes. Now I have a few options. Don't forget, I own a pharmacy, right? Here are my options. I could have gotten in my car. I live in West Philadelphia. I could have driven to Bucks County to pick up the meds at our distribution center. I could have had a medical courier deliver my medication to me later in the afternoon. I could have paid for an overnight, like FedEx delivery, to have it delivered first thing in the morning the next day. Or I live 2 blocks from a CVS. So what I did was I called our pharmacy. I'm also a patient. And I explained that, like, I wanted to get the meds. I wanted to walk over to the CVS. And our pharmacy, I'm under the care of our pharmacy. So as a patient under the care of our pharmacy contacted the local CVS, facilitated making sure the insurance was all set up, the medicine was available to me, and I walked over a half hour later and the meds were just waiting for me. And that was the option that I chose. Coming back to Jason's point, it's all patient-centric. Whatever works best for the patient for that temporary medication or that urgent medication, we'll work with the patient. We'll work with you or the caregiver to figure out what works best for the patient, and we'll manage that whole process. So, Jason, you want to answer the question about C2 medications? Jason,
Sorry, Andy, I'm trying to be respectful of the mute. I sort of did a minute ago.
Okay, you okay. Got that.
Frida, thank you. He already did.
All right, good job.
That C2's antibiotics, emergent necessities, it's all part of that navigation circumstance. And keep in mind something, if someone's prescribed something on a more maintenance level, if they have Lyme disease or otherwise, and they're utilizing an antibiotic for a period of months, we can still include that in the regular distribution.
Right, perfect. Caroline, yeah, just to emphasize, it's everything that you would find at a traditional pharmacy. We have prescription medication, over-the-counter medication, vitamins, nutritional supplements, controlled substances, obviously everything in the diabetes space, glucometers, continuous glucose monitors, syringes, insulin. We also can provide guide dog and pet medication, and we can package guide dog and pet medication in similar accessible packaging. When I say that we have small accessible medical devices, things like talking thermometers, talking blood pressure cuffs, talking scales, small medical devices like that.
Andy, do you want to address the single dose medication for children?
Oh, sure. Thank you. We have for parents who are blind or grandparents who are blind or babysitters or caregivers who are blind. We have 5 over-the-counter infant remedies, liquid remedies that are packaged in single liquid doses. So it's essentially, it's like a 2-inch plastic tube that has a little tip on it. The tip can be ripped off pretty easily. And it's a pre-filled, measured dose of infant medications. We have infant acetaminophen, infant ibuprofen, infant, there's a cough remedy, an antihistamine, and a stomach remedy. And it's so an individual who is blind doesn't have to deal with the challenges related to measuring properly an infant medication or administering. You simply rip the tip off and squirt it in the kid's mouth. And so it's something we're hoping to build out that a little bit more. Right now, we're just working with 5 over-the-counter remedies. And at a point in the future, we're hoping to expand that into prescription medications as well. So Caroline, I hope that answered your question about the other kinds of medication. What is packaging? Does it have to be everything, or can it just be insulin? Oh, it's a la carte, whatever you need. If you just need a multivitamin, you can call it for a multivitamin. If you need 20 pills and insulin and a talking thermometer, we could do that too.
If I can jump in though, the one thing that I will say is that, and this is not necessarily a sales pitch to fill all the prescriptions, the level of clinical interface and the work that we do with, coordinating multiple prescribers, knowing everything the patient's on and being able to manage their full picture really provides an extra level of care for them that they may not be getting now. Navigation and continuity are massive in healthcare. And what I mean by that is that patients seeing more than one prescriber with more specialty focus often get caught in the middle of 2 or 3 prescribers who don't necessarily communicate well to each other. So if we're filling insulin, that's fine, that's great. But if they're on 3 or 4 other medications and there's issues going on with their other drugs, they lose the opportunity to benefit by all of the clinical interventions and the continuity and navigation between prescribers that we provide at no cost. So if you're a patient who's diabetic and you have cardiac issues and it's sort of affecting your kidneys, now you have 3 prescribers most likely along with your general practitioner. We don't know about the rest of your drugs, we're not filling them for you. You've kind of lost an opportunity to get a really broad or widespread clinical intervention as well. So will we do that? Of course, we'll help anybody for any reason, but it puts them at a significant sort of what I would call detriment clinically to not know everything or have everything in front of us.
Perfect. All right, I'm keeping an eye on the time. We have to sort of wrap this up. So a few things just to summarize. First of all, Jamie, thank you again. And thank you everyone else for joining us today. Jamie will share this PowerPoint. There are links to Be My Eyes. We are currently starting to enroll people for a February program. So anytime you're in a home, essentially, whether the person's diabetic or pre-diabetic, and pre-diabetic, as Lynn explained, is very loosely defined by the CDC, they would benefit from this program. I also encourage anyone here, if you're interested in learning more about eating healthy, exercising more, losing weight, we'd encourage you to join the program. There's a lot you can learn that you can ultimately share with your customers. We are taking on new patients. I encourage you to also download Be My Eyes, encourage your clients to download Be My Eyes, your customers. So much that tool can be used to help people manage their healthcare and help navigate the world. Finally, if anyone wants sample kits of our packaging and labeling, please email info@accessiblepharmacy.com. We'll send you some samples. We'll review the samples with you. And also, I would love to, if anyone would like to volunteer to speak with some of our blind college students this summer. just for a few minutes, just to give them a glimpse into your world. We would greatly appreciate that. So just shoot us an email. A few of us see the info@accessiblepharmacy.com email. So we'll jump on that and respond to that quickly. And if anyone has any follow-up questions, please feel free to reach out to us. We will be circulating, I don't want to call it a newsletter, but like updates about trends in diabetes management and accessibility for the blind community. We'll share that with Jamie so that she can share it with everyone. We'll try to do that quarterly or a few times a year. Yeah, thank you, everyone. We really appreciate it. Jamie, thank you again. You're a star. You're really awesome. You're very generous to us, and we're really grateful.
Thank you, everybody. Thank you, guys. We appreciate it. If anybody, the PowerPoint and documents are attached to the invite. They're on our T drive. So if you need anything more, their email address is in it. You can always contact me as well. And thank you again.
All right, bye, everyone. Thanks again. Enjoy the rest of the day.
Thank you.
Thank you.
Thank you.